Everyone to the April Poverty and Homelessness Board all-member meeting. My name is Sean, and I am the chair. I'm reviewing the agenda today that we have a public comment, followed by the approval of minutes and March statement reviews and the all-in financial summary. Sorry, the minutes are from February. And then next on the agenda, we have the federal funding update, which is going to be done by Kate, as James is out today. Coordinated entry, written standards, and with that, we'll have a vote. The sanctuary status update from our elected officials, and then the strategic planning, next steps, discussion, facilitated by Kate again. And then there'll be an opportunity for questions in regards to the reports that we got from the committee. And then our wrap up before we adjourn. Okay. And then with that, it would be helpful for me if we could just do a round of introductions, and then that way I could do my check marks and make sure we have a quorum. So I'm going to go to my left.
Okay, Mike Fleck, member.
Reagan Watches, City of Eugene staff, but I am filling in for Mayor Knudsen today, who sends her regrets that she can't be here.
Florida, Lane County staff.
Matthias Smith, Youth Representative, Vice Chair.
Kate Budd, Human Services Division Manager with Lane County staff.
All right, and then I'm going to move up to the screen, and I see Counselor.
I'm Corey Rodley, she, her pronouns, and I am a city councilor from Springfield, and I am the super sub here for Mayor Van Gordon today. And I believe that Aaron is also unable to make it. And I have to pop off right at 1. So if I abandon you all, that's why.
Commissioner Farr?
Thank you, Chair. Pat Farr, I currently serve as the Vice Chair, one of the co-Vice Chairs of the Poverty and Homelessness Board, representing the Board of County Commissioners. Good to be here. I apologize that I'm not in person. I always complain when people aren't, and now I'm complaining about me.
All right, and Maggie?
Hi, I'm Maggie Bagan, Poverty and Homelessness Board member, and I apologize. I had to work at my regular job today, so I'm appearing by Zoom.
Thank you. No need to apologize. We all have another life. Glenn?
Good afternoon, everybody. I'm Glenn Porter, also a Poverty Board member and with Equitable Social Solutions. And I do have an update, Kate and Sean. So I wanted to take a few minutes real quick of this time to thank the board for the experience that I've had with you guys. Over the last week, I've had to make a tough decision, and I will be transitioning to relocating out of Eugene going forward. So this will be my last attendance in with the Poverty Board. But, you know, with the good grace of Kate, I wanted to take a few minutes or a few seconds to thank you guys for this experience. Thank Eugene, thank the City of Eugene, thank the City of Springfield, and of course, overall Lane County for being extremely welcoming to me and my family as we moved out here to take over the project. Springfield, Eugene, and Lane County have been nothing but good to me and my family. And so I want to take a few minutes to thank you guys, thank your communities, thank all you board members for all you do and for welcoming me over the last 2.5 years. It really was a tough decision that I had to make on a short notice, but I had to make the decision for what's best, you know, for the family and stuff like that. But transitioning out, you guys are going to be left in good hands with our organization. But more importantly, I wanted to thank you guys for the experience that I've had with you guys. So thank you. I'm super grateful to experience this time with you guys.
Thank you, Glenn. We're definitely sorry to see you go, but we understand. Family first.
No, I appreciate it. I did get a little crackly in my voice because it is, it was a tough decision. And like I said, you guys have been great. I love the community, the city, the town. I love everything about it. So from the bottom of my heart, I truly appreciate you guys and, stay in the fight, and I love what you guys all do.
And Jack?
Hello, Jack Boyson, non-voting member with St. Vincent de Paul, and thank you, Glenn, and thank you for everything you've done. Yeah, and sorry I'm not there in person as well. I'm at we had an emergency on the veterans side, so I'm remote in.
Thank you. And then we have two individuals that I think have been approved, or wait a minute, approved.
They were voted in as PHB members during the executive committee last month, but have not yet been voted in as PHB members by the Board of County Commissioners. And so Jonna and Kim, welcome. Really pleased to see your face. I'm really excited to get to know you better and for you to be a part of the board. You're in this kind of odd middle point right now. And I see Sherry too. Welcome. And Sherry is also a new board member. And so if you'd like to introduce yourself as well, Jonna, shall we go first?
Hi, yes, my name's Jonna. I work for Full Access here in Eugene. I support individuals with intellectual and developmental disabilities, and I'm super excited to be here and work with you all.
And Kim? And Kim, we're not able to hear you. It isn't. I know these tech issues are the bane of our existence. Well, Kim, welcome. And Kim is the new executive director with Hope and Safety Alliance.
Yes.
Oh, we hear you now.
There we go. Great. Yes. I'm not sure. So yes, I'm new executive director for Hope and Safety Alliance, and I'm very excited to be part of the board. So thank you very much.
And Sherry?
Hi, my name is Sherry, and I am here in lived experience board member. I think that's what it was. I will be working, even though I don't know you, Glenn, I will be working for Equitable Social Solutions. So, but don't come at the board from that level, like not coming at them from trying to speak for Equitable Social Solutions.
Thank you. And welcome to all three of you. And Heather, you want to introduce yourself? We're just doing introductions. We haven't gotten any farther than that.
Okay. Am I on? Okay. Heather Quasanza, Director of Philanthropy for Community Supported Shelters and a voting member of the PHB.
Thank you, Heather. And we do have a quorum today, and hopefully that gave folks enough time, if they were thinking about they want to add something to public comment, to queue up. Do we have? All right. Go ahead. It's Glenn.
Sorry, I actually took the time for my public comment during the introduction, so I apologize about that.
Okay. All right, and that was all for public comment? Okay, all right. Thank you, everyone, for attending today, both virtually and in person. And with that, let's move forward to a vote on approving the consent agenda. Do I have a motion?
Chair, I'll move the approval of the consent agenda.
Thank you, Mr. Fleck. And do I have a second?
I'll second.
Thank you, Heather. Any discussion? Okay. With that, all those in favor?
Aye.
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 Okay. Any opposed? Any abstentions? All right. Thank you. That passes unanimously. All right, and with that, we're going to turn it over to Kate.
So as Sean had mentioned, James sends his regards. He's not feeling well today, so I'm standing in for him. It's no surprise, I'm sure, to any of you that there is a lot going on at the federal level. And the fact is, it is a moving target day in, day out. And it feels like things are changing on an almost hourly basis. And so I'm just going to give a high level touch point on a few things that are really at top of mind within HSD. Firstly, at the state level, we are fortunate at this position of time that the shelter framework bill continues to move forward in the state legislature. It is in the Ways and Means Committee right now, which is positive because that's where it needs to be if it's going to continue to move forward. We have had considerable both public testimony and written testimony in support of the shelter framework bill from many of you at this table, as well as other community members, which is greatly appreciated and we hope will continue as the opportunities arise. And one key thing that we're waiting for at the state level is there will be a state budget forecast released in early May, and that will help legislators understand like the total amount of money that they can allocate out for the next biennium. And the last forecast was positive, as was the prior, but there's a lot of just hesitance around what this next forecast will bring, and if there might be additional dollars that the state can allocate beyond what they're anticipating today. So if that's the case, then there's an opportunity potentially for the shelter framework funding to be more than just sustaining the shelter beds that exist through the all-in executive order funding that exists today. There also might be opportunities across long-term rent assistance and other programs that were developed through the all-in executive order to see bumps in funding, which also would be positive. So we're paying very close attention there. Going down to the federal level, we have received the Schenkel MLK Continuum of Care Renewal Grant Agreement, and that was expected, though not guaranteed, so we were really pleased to have received it. It did include additional requirements that we had not seen in Continuum of Care agreements before. It included not being able to use federal funds to pay for health care that allowed elective abortions, which was new and something that Lane County is needing to work through. It also prohibited entities from not following the current federal executive orders. And while there are many, the key executive orders that we're really closely paying attention to are those related to DEI. And pointedly, right now, based on executive orders, entities that need to follow them may not prioritize based on race, ethnicity, or gender identity. And most of the Human Services Division programs do not prioritize in that way. If we think about our front door assessment, for example, there are priorities within it, but it's often related to aspects of populations disproportionately affected by houselessness, as opposed to going right to prioritizing folks of color, for example. Instead, we're looking at having the lowest level of income, having a significant behavioral health challenge, for example. And so we are thinking through as a county, what does this affect and what changes might the county need to make in order to be in alignment with the executive orders. And that's the process that Lane County is in today. There are ongoing discussions internally around whether this continuum of care agreement will be signed. And as you can imagine, what Lane County is having to consider is really, do we make changes based on these executive orders, or do we not accept the continuum of care funding, for example? The continuum of care funding that very much supports those who are the very most marginalized within our community, and could very much lead folks to fall back into houselessness very quickly. And so, these are really hard decisions that are having to be made, and discussions that need to occur. And I recognize it's not unique to Lane County. We know nonprofit agencies are having to weigh these considerations. Colleges, many entities across our nation are. And so we're just, one entity among many. I will also share that should Lane County sign the renewal grant for Schenkel MLK, for example, we would need to pass those requirements that we're working through onto any agency that we subgrant to. And so those same requirements would need to be met by those entities as well. And I respect that those entities need to make their own tough decisions too. And so it's a tough time for everyone right now. And I know, our county council is very much in the weeds and, helping us all understand what the requirements are. And their greatest challenge is that the requirements that they bring forth today may change tomorrow due to changing precedent within our courts. And so that makes it even more difficult. Let me stop there and see if you have any questions. Heather?
Is public comment still being accepted for House Bill 3644?
At this point, so House Bill 3644 shelter framework, at this point, I'm not aware that there is a hearing scheduled. I could be wrong, but once that hearing is scheduled, then they would start accepting public comment again.
Okay. We have Reagan.
So you mentioned these guidelines from the federal government would be passed down to subgrantees. Is that only subgrantees who are receiving federal funds, or is that all, subgrantees of Lane County?
Yeah, that's a great question. And so it would be just through those who are receiving federal funds. The challenge with the way that the federal fund contracts are written, so the agreement that we have right now, for example, our county council does feel like it's an umbrella clause. And so should an entity receive federal dollars, they would need to follow it across their agency. It wouldn't just be related to the federal programming that is being supported.
And then Mateus, that was your question? Okay.
I believe that they likened it to herpes yesterday. Is that what I'm hearing?
Why don't you share more?
The way that the requirements are being passed down. It's you have the key signing agency, and then any subsequent people that are signing to do the work underneath the contract then also receive the benefits of the contract and all the stipulations that go along with it, according to the finance advisory meeting that was yesterday.
Thank you.
Yeah, not just throwing out there what that was. That was very much seemed like a non sequitur, but it wasn't, I promise.
And I think Sherry had a question about the House bill.
I was just trying to find it online and I was like, where is it? That's not it.
Yeah, House Bill 3644.
I can put a link to it in chat.
Thanks, Commissioner Farr.
Thank you.
Ask another question regarding, like, everything is kind of up in the air and we're kind of making this up as we go because this is a new crazy world that we're living in. Will Lane County be providing guidelines to organizations that it's subcontracting through so we have a very clear understanding of what our policies and procedures need to be to make sure that we are in compliance if we do decide to take the funding?
That's a great question. I am happy to get back to you on that. I think at this point, I think every agency would need to do what they feel like they need to do in order to protect themselves and to mitigate the risks. And I'm not sure on whether Lane County would feel like they are in a position to, direct an agency as to, how to protect themselves. So I'm happy to get back to you, but I think that what we're hearing, at least from advocates, is that each entity would want to consult their in-house legal support, and again, mitigate the risks to the very best of their ability.
So as the county, you would be able to point to, for us, where things have changed and the new requirements. And then the onus is on us to work through that process as to whether we can do it and still meet our missions. And then also to seek counsel in how things are rewritten or updated to make sure that we're best in compliance.
Well said, yes.
That's going to put a large financial burden on a lot of nonprofits, and it's going to make it so even applying for these funds is going to be difficult if we know that there's all these other requirements that are attached to it.
Yeah, I think it's a great point. We're all in a tough position, and it definitely disproportionately affects smaller agencies.
How does, and I have like 1,000 questions, and so I'm willing to take this offline if necessary, but I'm just wondering, with Oregon being a sanctuary state and the requirements and the what we have coming from the governor's office regarding complying with these executive orders, and then what Lane County is doing as a whole and each individual city is doing from there, like, it's like a weird legal quagmire to be in right now. And all of us are just trying to do the best we can for our constituents. But like, I feel like, I don't know, this is just ridiculous and unfair and ridiculous. Like, this is just ridiculous. And yeah, I have lots of thoughts on this, but.
I don't see a spot to raise my hand. I'm sorry. Of course, Commissioner Rodley, Councilor Rodley, excuse me.
Go ahead.
Were you calling on me, Commissioner Farr?
No, I wasn't. I was trying to get in the queue, but saying that you were there first.
Thank you. So I have a couple of things to say. One, I just really want to just sort of highlight and acknowledge how much work this is for staff trying to navigate this with the county council and other councils, and just take a minute to be like, this is hard and it's a lot, and everyone's trying to do the best they can with a situation that is intentionally to make people, is intentionally difficult and intentionally trying to sort of put people in places and in boxes. So I just want to say that it's rough, and I know that it makes people feel icky, and they're like, am I following my core values? How do I take care of the people that we say we're going to take care of? We've all done a lot of work, and I mean, maybe not all of us, but I'm going to say all of us in this meeting have done a lot of work over the past several years to try to like unpack white supremacy and to improve our systems and to acknowledge the way that government has done harm and try to change those. So I just want to acknowledge that, because that's part of what feels so hard and awful. And then the other piece that I want to say is I'm a little bit seasoned and I've been around for some decades, maybe not as long as Commissioner Farr or some other folks, but I've been around for some decades and I've been doing this work for decades, and we can still do it, right? We can still serve the people. We can still find the ways that there's this intersectionality about who is most affected by these policies and where harm has happened, and we can still fix it. We can operationalize it in ways, and that's one of the things that I've said in some other meetings is we can get really clear about how we're operationalizing these improvements without having to say DEI or equity or whatever, because these terms that become sort of co-opted and weaponized. But we're still going to do it, right? We're still going to keep doing it, and we're still going to keep finding ways to do it. And I just want to say that it doesn't have to be called whatever. Like, we could call it freedom work. We can call it whatever we want to call it, and still keep paying attention to the people that we know in our community that need our help. And I think we will continue to get better at it because of some of the trials and the struggles. And I just want to acknowledge the work that staff is doing. And then the third thing I want to say is I think that Heather really did highlight something that is, I know that Kate understands, is that one of the roles the county can play, or this organization, this group can play, is our nonprofits don't have the capacity to have inside counsel or high-level fundraising and financial advisors and things like that. So anything that we could do as a collective and a group to support them, because those are the folks that are on the front line of those services. But this kind of stuff can be really burdensome for those small nonprofits that are just trying to serve the folks. So I think that's a place to focus moving forward, is like, how do we support them as the county and the state and people figure out these bureaucratical government pieces? How do we sort of take on some of that so that the nonprofits can then do the work that is going to continue to serve the people that we're all here to serve? Thank you.
Thank you. And Commissioner Farr?
Well, thank you. I'm glad to be following Councilor Commissioner Acting Mayor Rodley, because we couldn't have said it any finer than that. We will still do the work. Our values aren't changing. The people we serve are still the same people, and the reasons we serve them are still the same reasons. That will not change, and we'll continue to do that. The county can and will provide a leadership role, not just for nonprofits, but in general. Next, we have an agenda item that I'll talk more about this, but on Tuesday, the Board of Commissioners will be reaffirming our commitments in a statement that's already been published. It's going to be in a board order on Tuesday. I'll talk more about that when it's that time on the agenda. But what Councillor Rodley has said is exactly right. We do the work. That's not going to change. We're going to do the work the way that we always have, and we will we'll provide an example to other jurisdictions of how to do the work. That being said, everybody's going to feel the pinch, the financial pinch from this. And here's the part that really I hope everybody pays attention to, is in every congressional district and every state in the nation will feel the pinch. And hopefully that pinch will be recognized when the next time it comes time to elect officials.
Thank you.
So more when it's my turn.
Thank you. Any other thoughts for discussion before we wrap up this heartbreaking section? That's all I could call it, and stressful. So, and I know there are a lot of places that are really struggling with this, especially since for a lot of agencies you have multiple funds from multiple resources in order to do the work that you do. And so to have this overarching umbrella that has to shape everything from all your programs is a really struggle, a big struggle, and creates a lot of anxiety. And I will say, and maybe we can be more proactive and share information with each other, because I have, every now and then, there's a resource that goes through my email about resources that are available and trainings that are available that are put on by entities and lawyers about how to increase and look for compliance with these new rules that are available, that maybe we can share with each other as well. Not that we would endorse it, but just to give an opportunity to get information from people who have been studying this in a more cost-effective way before maybe having to think about reaching out for an attorney. So I've seen those. I haven't looked at them yet, but I guess I better get on that myself while I'm saying that out loud. But that might be an opportunity to share as these kind of resources come out about how to write policies and procedures, and how we can still do the work and still have the language and meet our mission and make sure that how we have things written and we implement it falls within the new policies.
And feel free, if you see something like that, you're welcome to send it to myself or James, and we can send it out to all the PHB. And my hope is that at some point things stabilize, and then it gives us a place to be able to jump off. And I think more of those webinars and more of these like resource guides and toolkits will be made available that we can share and will be valuable for folks. So really appreciate Councilmember Rodley's point, and that, you know, myself and James will absolutely share what we can and provide whatever resources might be valuable in helping to guide agencies.
And also, as we're looking at poverty and homelessness, that all of these pieces go hand in hand when we're looking at equity, and a lot of times all these pieces follow each other. If there's no equity in one section, that normally, looking at the whole life, there's inequities in all different sections of an individual's life, whether that's income or access to resources. They all blend hand in hand. So we do have to keep that in mind, of even as we have to parlay of how it's worded, that all of these pieces, when we're working with human beings, are all tied to each other. And so inequity in one part of a person's life usually leads to inequity in multiple parts of an individual's life. All right. With that, okay. Thank you, everyone. And now we're moving on to the coordinated entry written standards.
All right. Hi, I'm Andrea. I use she, her pronouns, Outreach and Coordinated Entry Supervisor at Lane County Human Services. I am here today to share the work that the Coordinated Entry Committee has been working on through several years and has all been compiled into an updated version of the Coordinated Entry written standards. So just a brief overview of what these written standards are. Essentially, they are a document that will guide all of the work that happens within the coordinated entry system. So all the way from access to intake to referral to housing resources through coordinated entry. And they are also going to outline all of the policies and procedures that guide all of our work. So this is about who is eligible and how it works. So in a perfect world, you would be able to pick up this document and know every single aspect of our coordinated entry system. And should we run into a problem in our coordinated entry system or like a kink, we would be able to refer to this document and find some guidance on how to move forward. Just some reference on what we're talking about. Some more background. I think this group has, and by I think I know this group has had several meetings about coordinated entry and are well in the loop around coordinated entry, but just a brief overview that the coordinated entry system is a system that's used to triage folks who are experiencing homelessness into our community's resources. And so HUD mandated that communities move to this model where we're coordinating that intake and that referral for our most vulnerable community members into our housing resources, with the idea that we would use our housing resources for the folks who are the least likely to self-resolve their homelessness episode. So HUD mandated it in 2012, and then we in Lane County started doing it in 2013, and it was piloted with just families. So all families in Lane County were given that assessment and placed on a centralized wait list and referred to programs that way. And then in 2014, the following year, it expanded to singles. This version of the coordinated entry written standards is the first update since they had created them in 2017. So there's lots of work that has, like the coordinated entry system itself has expanded greatly since that first reiteration. So some of the big things that have changed since 2017 with coordinated entry is access. Two major changes to access were, one, we have provided virtual access, so folks do not need to physically present at a front door access point in order to receive access to the coordinated entry system. They can now contact 211 or put their information online to be contacted back. We have also implemented the diversion housing problem-solving conversation as that first step in our system. So all of our front door assessors are trained to have that strength-based conversation to see if we can divert households away from our coordinated entry system and quickly into housing, so that the only folks who we have on our centralized wait list are folks who cannot be diverted away from and need that longer-term rental assistance or support. Another big change we did since 2017 is a lateral transfer policy. This policy is intended to support when a household is enrolled in a housing program, typically rapid rehousing, and that rapid rehousing program has done all the things within its power to help a household stabilize and lean off a subsidy, but has been unable to or needs a greater, just greater case management support. There is now infrastructure in the coordinated entry system to laterally transfer them into a permanent supportive housing project. This is like as opposed to if you were in a rapid rehousing program, not doing well, not having enough stabilization or case management, and then becoming homeless again, and then having to go back onto the coordinated entry list. So we can now put them straight into a PSH program. Another change has been the inactive policy. So one thing that many coordinated entry systems experience is when we're doing assessments in the community, we're placing folks who are vulnerable without cell phones, without easily access to be communicated with, on a centralized wait list. And so sometimes those referrals to housing programs were not fruitful. They could not get a hold of them, they could not find them, and then those program vacancies are staying vacant. The coordinated entry system is not working very well to get folks quickly into housing. And so the inactive policy works in two ways. It works to ensure that folks using the coordinated entry system are doing their due diligence to be sure that we're getting in touch with folks. Like, we're actually working quite hard to be sure that we're contacting people who are prioritized for housing. And then vice versa, if folks are inactive in our system and they are no longer experiencing homelessness, or if they have moved out of our community, we are able to mark them as inactive and then go to the next participant to ensure that those housing programs are quickly filled. The biggest change is we have moved away from our initial go at a vulnerability assessment, which we initially used a tool that was used quite heavily in the nationwide called the VI SPDAT. Y'all might have been familiar with that acronym. We moved away from that about a year and some change ago into a homegrown tool called the Vulnerability Assessment Tool, which was created by the Coordinated Entry Stakeholder Committee. And the intention behind a new tool is to increase equity around all of our folks who are experiencing homelessness in our community, and also just to better the experience for both the assessor and the folks who are being assessed in a more trauma-informed way, a little quicker, a little less invasive. And then we have also reworked our prioritization model with our coordinated entry system. Prior to this change, our community used to refer folks differently to rapid rehousing than PSH. So there was a score that folks would receive with our old tool that was up to a 7, then they would be referred to rapid rehousing. And then if they scored higher, they would be referred to PSH. But we have reworked this to ensure that we are always at any given time referring our most vulnerable household to our resources. So Now we refer all folks who are scoring high and are vulnerable to any housing resource that's available. And then we also implement case conferencing, which is new. And case conferencing is holding at its core that we know that we're never going to get it perfect with an assessment tool and a questionnaire when trying to understand a household's vulnerabilities and housing barriers. And so case conferencing is infrastructure and a tool that we can use where assessors or folks who are working with these participants can come and talk to us anecdotally about why the assessment tool might not have captured that household's vulnerabilities or other vulnerabilities that we're just not capturing in our system one way or another. So we have some buy-in from our community to help us figure out to ensure that we're referring our most vulnerable households to housing resources. Questions on that so far? Because I think we're going to pivot a bit into some more detail.
Regarding the inactive policy, so who came up with the 2-week timeframe?
I will be transparent that that was created prior to my time here, but I would assume it was a coordinated entry committee that sort of drafted that and got to that.
Okay.
The 2-week.
And have we done any data research to see whether or not, if the 2-week period is passed, how many people are like just after that 2-week period, like they're in the 15 to 20 day range or the 20 to 30 day range before they re-engage with a provider?
It's a wonderful question, and I can't say that I have meaningfully looked at that data, but I can look at that and see what we're seeing and get back to you.
Because I'm just wondering, like, from personal experience and the clientele that we work with, like 2 weeks is often not enough time to reconnect with people, especially if they have struggled with maintaining access to communication devices or email or whatever the case may be. So it'd be interesting to know how many folks are re-engaging after they're marked inactive and what that time frame looks like to see about adjusting for realistic expectations, or like changing how, like if they're marked inactive, like can they still, like do they have to start the whole process over again, or can they still be somewhere higher on the list if they re-engage?
Sure. Yeah, no, I'm happy to look into it. And what we would look at is like how soon after we close their FDA are they touching our system again? And I think it would data point. Yeah, thank you.
The case conferencing piece, is that part of the training that assessors get of like knowing when and how to access the case conferencing to ensure that they're representing the folks that they've assessed and make, because it seems like there may be, if you have a person who has a case manager and assessor who doesn't know to attend the conference, are they losing out because they don't have someone at the table?
It's a really good question. We do train all of our assessors about case conferencing and ensure that they have that invite. I do think our community is still really learning how to use that infrastructure in the most effective way. But yes, all assessors should have that training and have that on their calendar.
So along those lines then, are there agencies that are typically not at the table because of staffing shortages or availability of staff? Like that's going to then negatively impact the clientele that they're serving if they don't have someone at the table?
Sure, I don't disagree with you on that. I think that is an inherent flaw of case conferencing in some ways, and goes to that buy-in of trying to ensure that we can make it as accessible as possible to our assessors. Okay.
I did just want to say, while we're looking at the of how soon after they're inactive that they go back onto the list, I think I would like to see also how much faster are we getting people into housing. So I know we did a similar model, and there was a lot of anxiety because we had long wait lists, and so there was a lot of anxiety of, well, if you close it too soon, then people aren't going to get in. And over longitudinal time, what we found was that by having these long wait lists where people sat forever, we weren't actually helping as many people as we thought. And if we could keep the wait list down and make it very easy if you missed your, well, for us, it's appointment or whatever, to get back in, but to make it as quickly as possible to be able to put back on the list, and process people on that list quicker, we actually did have better outcomes and more people getting the help that they needed. And so that would be really nice to see if this inactive policy is also coming out with the other outcomes of if we do find people, are they able to get back on the list quickly, be assessed, move back up on the list? And so we have people going in and people going out, and it has that flexibility of folks being able to get on the list when they're engaged on and off the list in a manner as well, so that we're serving people and we're getting people in the housing, but it's not so difficult and the list is so long that when you do have to start over, it's taken a long time.
Sure, yeah.
So, because I know folks get frustrated about the wait list.
Yeah, yeah, absolutely. And I can share just like anecdotally that we do see folks who are chronically homeless and fall out of communication, and then they are quickly reprioritized, which is kind of the gift around the language of centralized wait list is a bit misleading because it's not a wait list, right? And so there's a gift around you are our most vulnerable household, and if you're assessed again, you should be shooting back up to the top. However, I think what I heard was we want to know prior to implementing the inactive policy, the length of time folks were experiencing homelessness prior to being housed, and then after the average length of time since we've implemented the inactive policy. Is that accurate?
I think just, and even when we enact it, of just monitoring the cycle of that we're getting the outcome. So if we have the 2-week wait of are people who are inactive, are they able to get back on the list as quickly and then get moved up and prioritized where they should be with their scoring?
Sure.
So that it's kind of like a rapid access process, because I know with outreach and like what Heather was saying, sometimes it may take a while to find somebody, but to make that process as smoothly as possible of can they get reassessed really quick and then be reprioritized when we actually find them.
Sure, yeah. Thank you. Okay. To keep us moving, I know our community has talked a lot about diversion, but just wanted to put another ping around that all of our assessors are really trained in this diversion, and we really put a lot of weight on that piece of front door assessment. So we've moved away from when a participant comes to a front door site, having just a questionnaire and be placed on the centralized wait list. And instead, we're really slowing that process down and sitting with participants to have this really strength-based conversation around how can we get you out of homelessness as quick as possible. So that has really been a win in our community. Yeah, and again, is part of that model of trying to get folks as quickly as possible to housing, as opposed to just placing them on this wait list and sort of having them wait there. Diving into the vulnerability assessment, this is a tool that has been created by the Coordinated Entry Committee, and they have used other communities' guidance and then have also tailored it to just like our local population and our local needs. And so I'm not sure how deep we want to go into it, but we have it sectioned out in 3 different areas that we're assessing. One is the physical and mental health barriers. One is substance use barriers, and then the last section is equity, so generational or like discrimination as who you are as a person. So we've implemented this new homegrown vulnerability assessment in our community for a year and some change now. And at the year mark, we have asked for some feedback from both our assessors, the participants themselves, and then we've dug into some data as well. And so this is just a brief overview of a survey from our participants themselves on how they were receiving or like what the experience was like going through that assessment. And we can see here that we are seeing generally good feedback, that participants are feeling like this assessment did allow them to express the challenges that they faced during their homelessness experience, and that the questions did not feel too personal or make them too uncomfortable. So generally positive feedback. And then similar and alike, the feedback from the assessors themselves was generally positive as well. They felt relatively confident, some slightly inconfident that the vulnerability assessment tool allows them to accurately evaluate the vulnerabilities of participants. This is not surprising to me. We know that an assessment, a questionnaire is really never going to do that, and so we can only be somewhat confident that that does that with the opportunity to come to case conferencing and have more discussions around that. And then did see the majority of folks said yes, that this new assessment tool helps reduce bias and promote equity among coordinated entry participants. So digging into the data a bit, our data folks were able to pull data on who has completed the vulnerability assessment and broke it out by 3 different subpopulations. Broke it out by our white-only households, our BIPOC non-Hispanic households, and our Hispanic and Latinx populations. The reason we separated our Hispanic and Latinx populations away from our BIPOC and non-Hispanic is because when we looked at the data at first, just white and BIPOC, we did not see any difference between scores at all. But then when we dug a little different, there was some score differences between our Hispanic and Latinx populations in comparison to our other BIPOC populations. And so this graph is sort of confusing, but what we're seeing is the orange lines are our Hispanic and Latinx populations, and we're not seeing our Hispanic and Latinx populations score all the way to an 18. So they're generally scoring a bit lower than our non-Hispanic and white households. So when we looked at it a little closer, we learned that our Latinx population and Hispanic population are also tending to be younger in our coordinated entry system. And so our vulnerability tool has some questions that you're more likely to say yes to if you're of an older population than if you're younger. And so we're seeing that they have the highest percentage of youth 16 to 24 and the lowest percentage of folks who are 55 and older. And so when we were discussing this within the coordinated entry committee, I think what we're seeing is not necessarily, we haven't really determined that this is an issue with our vulnerability tool itself, but rather we might have an access problem for our Hispanic and Latinx populations. Like maybe we need to do more targeted outreach to be sure that we're reaching all of our population who are Hispanic and Latinx and experiencing homelessness, as opposed to just our youth, because we're doing a good job at reaching that population who are youth, but maybe not as good of a job at reaching those older folks. And so we are trying to work through some targeted, culturally responsive access points for that population, and then are also going to explore some focus groups around the experience of folks who are Hispanic or Latinx and their experience with the coordinated entry system to learn how we can better reach that population. Yes.
Is the vulnerability assessment tool in Spanish?
Great question. It is not in Spanish.
That would be a really quick and easy fix to probably get more people engaged. Put it in the language they speak.
Yeah, thank you. I'm going to keep us moving to case conferencing in our dynamic prioritization. So this can be a bit overwhelming at first, but we're going to read this graph from the left-hand side over to the right before we go down. So when we have an opening in a permanent supportive housing project, or any of our housing projects really, we're always going to start with anyone in our community who is already enrolled in a housing program and is requesting a lateral transfer for safety reasons, for DV-related reasons. We're always going to refer that household first. If we don't have any folks in our community who are enrolled and have identified a lateral transfer that are of that population, we would then go down to any households who have requested a lateral transfer for any other multitude of reasons and have been approved. So we're always going to do lateral transfers before we do anyone else off the CWL. If we have two households where, if we don't have any lateral transfers ready for referral, we're then going to refer folks off of our centralized wait list. We're going to start with all of our chronic homelessness households because we as a community prioritize chronic homelessness. And then we're going to then we're going to go to our vulnerability score, trying to find the household with the highest vulnerability. And then we use that case conferencing if there's any conversation to be had around this household scored this, but is more vulnerable than that household because of X. And then likewise for all of the other communities. I will say we don't often get below chronic homelessness. We don't often go into dedicated and literal because we have many chronic homelessness households in our community. Great question. I might have to pass it to Amanda, but it is another HUD definition of, in my words, almost chronic but not chronic.
Yeah, there's a number of other criteria. It's sort of an expanded chronic homelessness definition that HUD released several years ago. So there are certain projects that have that designation that can serve dedicated plus. So it includes those who are chronic, but also there's only a couple of the categories that really apply. There's a lot that are very rare that would not really come up in our community. But there are some, like for instance, if they are chronic, but they have not had, they've met the time of homelessness, but not over the 4 episodes, or they sort of fall through those very specific cracks. It's kind of to address those populations. So there's like 6 or 7 different criteria.
Is that definition anywhere in these documents?
I don't have the HUD definitions directly in the document, no. I don't believe.
Yeah, we can add that to the, Amanda, would you be willing to add that for next meeting?
Either add it, a glossary, or link to that. It's available online.
Thank you. So then there are other project types in our community that have some slightly just different criteria for their programs. So our youth homelessness demonstration projects, they of course are directly to serve folks who are 25 and younger. And so those will look a bit different. Similar process though, from chronic to literally homeless, lateral transfers first, et cetera. And then our host homes project is a bit different as well, where we're gonna always serve youth, and then we're serving literally homeless households with the lowest vulnerability. And that's due to the project type and some of the work that they have done under the Youth Homelessness Demonstration Project. We're gonna move away from the prioritization and referral. Any questions lingering there? And then the other pieces that are new to our written standards is we are working on building out, ensuring that coordinated entry is accessible and serving our participants in our community who are fleeing or attempting to flee DV. And so we now have a funded access point here in Lane County that serves folks who are fleeing DV who can go onto our coordinated entry wait list in a de-identified way, and now they have the same access to our housing programs as folks who are experiencing that literal homelessness definition per HUD. And then we are working towards increased training for our front door assessors to provide a warm handoff to a victim service provider. So if a household discloses that they are homeless because they are fleeing DV, that we would be able to provide that warm handoff to somebody who knows how to serve that better and protect that household. And then the safety transfers priority for referral. So again, this is that very first priority when we're looking at when there's a program saying I need a referral, we're always going to be sure that if there's a safety transfer, that person's going to go first. So still building out some of these processes and getting better at them, but have them included in our coordinated entry written standards. That's somewhere we want to keep going. That is all I have.
Any questions? Discussion points? This is something we have to vote on. Yes, we do. Go ahead, Reagan. Go ahead.
I'm thinking about the phrasing, and you mentioned like the centralized wait list. Sometimes it conjures up something that isn't quite how it works. And is the front door assessment kind of synonymous with the vulnerability assessment? Are those kind of used interchangeably?
It's certainly possible that in the community the language is interchangeable, but now that we've implemented that diversion housing problem solving conversation, we really, it's important to me that the assessment includes that in it as well, as it's not just like a survey to be placed on the centralized wait list. So the process should include that diversion housing problem solving.
That makes a lot of sense, because I feel like years ago, there was this, everyone should do a front door assessment, and everyone was supposed to do this front door assessment. And then we realized like the list was like super long and not that many people get referred because we don't have enough resources. And so thinking about how the community hears this and maybe getting more towards that shared understanding that a front door assessment is that full, assess the phased approach, not just the tool that gets you on the CWL. Okay, thank you.
Yeah, I appreciate that. Thank you. I also would like to see our community move to a different language there, to prioritization lists as well, as opposed to centralized wait list, because it can be a bit misleading.
Yeah, and they get used I hear them a lot, and I pick up that I think people think of them differently than they actually work. And, it's hard because I know there's so much work to do, and focusing on naming, you have to prioritize it with all the other things. But in the way that people hear things, I can tell, increased understanding could come from maybe thinking about how we call these things.
Yeah. The Coordinated Entry Committee just met yesterday, and we are eagerly awaiting how the strategic plan will play out, but I think that was one of the priorities that they have identified, as well as that language shift. Yeah.
Other discussion points?
No? Thank you for having me. Oh, there's a vote.
There's a vote, yes. All right, so with that, does anyone care to make a motion to approve the coordinated entry written standards?
Chair, I move approval of the coordinated entry written standards.
Thank you. Okay, a second. Thank you. All right, any further discussion?
I would love to see the definitions in it.
Yeah, absolutely.
Like have that be part of, like, approved with that addition, if possible.
I think we have, thank you for that. So I think we have that, and then that was the piece about getting it in Spanish as well. Okay. All right, so we have a motion and a second with those two pieces added on to the motion. All right, and with that, all those in favor?
Aye.
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 Any? Aye. Thank you. Any opposed? And any abstentions? Okay, thank you.
Thank you.
Thank you. And we are now up to the sanctuary status updates. I think we're going to start with you, Commissioner Farr, sorry.
Thank you. Excuse me. Well, next Tuesday, April 22nd, the 10 a.m. time certain, we have an agenda item. The Board of Commissioners has an agenda item. It's order number 2402-2205. Now, this is at 10 o'clock on Tuesday. If you pop into chat, I put a link to this agenda item. And if you scroll down the link, you'll find attachment B, which is called a statement reaffirming Lane County's commitment to the Oregon Sanctuary Promise Act and supporting the transgender community. It goes on to, there are several paragraphs in the statement. We've been working on this since November, and it's been a little bit frustrating to some of us that it's taken this long to bring forward, but we are ready to move forward with it. I anticipate full, complete support of the Board of County Commissioners. And once again, this will be read and passed on April 22nd. I'm going to read a couple of excerpts from it. There's a preamble, and then it goes on to say the rights of people in our community, especially immigrant, refugee, and transgender people, are under attack. Lane County recognizes that when the rights of one person or one group are undermined, the rights of all of us are at risk. In recognition of this threat, Lane County states its unwavering support for the rights of people in the immigrant, refugee, and transgender communities and stands ready to expand this support to other groups whose rights come under attack. It goes on to state, at Lane County, we remain dedicated to fighting for the transgender equality and recognition of the unique challenges transgender people face, including the need for gender-affirming care. Studies show gender-affirming care saves lives by supporting mental well-being among gender-diverse populations. Lane County must amplify the voices of transgender people, break down barriers, and ensure our county is a haven, inclusive for all. There's a number of bullet points involved. I'm not going to read them all in depth. Once again, you can read this in the chat if you scroll down. The entire statement is in there. A couple of the bullet points are that Lane County is committed to uphold Oregon's Sanctuary Promise Act to ensure immigrant and refugee communities do not fear local law enforcement and feel safe reporting crimes. Do not request immigration status of people seeking services. Provide equal access to services and care in the preferred language of the people seeking those services. Use every avenue permitted by law to support the state of Oregon in affirming the rights of transgender people of all ages to receive any gender-affirming healthcare that has been deemed medically necessary by a qualified healthcare provider. Uphold the rights of people to seek gender-affirming care, and to challenge federal policies that harm transgender people. And it wraps up by saying, to truly improve lives, we must cherish and inherit the value of every person, et cetera, et cetera. And then finally, discrimination has no place in Lane County. This is going to be read in its entirety on April 22nd, 10 a.m. time certain, and you can anticipate a complete unanimous support of the Board of County Commissioners. I'd love to answer any questions.
Any questions for Commissioner Farr?
Thumbs up.
All right. Looks like you covered it.
Well, thank you. So once again, read the entirety of it is in the text. Excuse me, in the chat.
Thank you.
Can we get that emailed out to us?
Yes, I've got it on my list.
Thank you.
And Reagan, I see they have Mayor Knutson and Mayor Van Gordon on this section as well. Did you?
Yeah, I can just share some of the information that Mayor Knutson shared at the January Executive Committee meeting about the cities of Eugene's sanctuary status. Let's see. So as Commissioner Farr mentioned about state statutes, Oregon has been a sanctuary state since 1987, and state statutes prohibit state and local law enforcement or public agencies in Oregon from participating directly or indirectly in immigration enforcement without a judicial warrant. In 2017, the Eugene City Council adopted the Protections for Individuals Ordinance, which amended city code to add Oregon sanctuary state provisions and specifically prevent the use of city resources, including money, equipment, or personnel, including from Eugene Police, for the detection or apprehension of individuals whose only violation of the law is that they are present in the United States in violation of federal immigration laws. Oregon sanctuary statutes have been updated several times, most recently in 2021 with the adoption of the Sanctuary Promise Act, which increases safety and protection measures. Eugene City Code prohibits city employees from collecting or maintaining individually identifiable immigration status except in very specific circumstances. City staff have also recently been provided with some updated guidance and information to support staff's compliance with state and local sanctuary laws, including things like what to do if a federal immigration official is trying to access a city facility or access information about individuals in order to ensure local and state sanctuary laws and policies are upheld. We also have our Human Rights Code, which includes protections based on many different classifications, including sexual orientation, which is defined to include gender identity, and the city's bias crime code makes it a separate offense to commit certain crimes based on another person's perceived gender identity, as well as other listed statuses.
Thank you. Any questions or comments? And I apologize, but I know Councilperson Rodley had to step off at 1 o'clock, and I don't think we have a representative from Springfield that is here. I think that was Councilperson Rodley. So we'll make sure to reach out to them. So, but I just wanted to apologize that they didn't get an opportunity to speak because of how we had the agenda set up. Okay. And with that, thank you, everyone. And with that, we'll move on to strategic planning.
Thank you. So just want to thank everyone for the feedback that has been provided thus far regarding the draft PHB strategic plan. It continues to be changed and updated based on that valuable feedback. And the latest version is available on the county website, and I'll share the link as we go through the slides. We are also going to hold an event next Wednesday, April 23rd, to invite folks to the Wheeler Pavilion to take a look at the different core items of the plan, the strategies among those core items, and then the specific action steps. With an eye for, among those different action steps, what might the guests prioritize around those? As you're well aware, if you've taken a look at the plan, it's a lot. And as we're thinking about what each year will look like, we very much want to prioritize down to, like, you know, what should we focus on with year one? And so this event will help with that. If you're not able to come to the event or you prefer not to, there's also a survey which focuses on the exact same question of what action items might you prioritize within the plan as it is today. So you should have gotten a flyer as a part of your packet that provided a link to the survey. I'll send that out again as follow-up in case you haven't seen it yet. The event will provide us just with more insight as to, you know, what are the priorities among those action items that folks would like to see move forward, and what realistically, you know, ought to be a part of year one of the plan. And we're also accepting feedback in general on the plan still at this point through May 1st. And so if you take a look at this latest draft and you have additional feedback, feel free to send it to James or myself, and we're happy to work to incorporate it into the plan. Looking at this slide right here, the tentative timeline is in April and May, continuing to gain feedback. We'll make additional changes to the plan in May and potentially into June. And then after that, sharing a final draft of the plan, starting to share out what work plans would look like and gaining feedback on those. And then we're hoping in September or, in July, that we would, or maybe August, depending on how the meetings fall, but then we would seek PHB approval of the plan. And then the next step would be going to the Board of County Commissioners in September, October, November, to be able to move that forward. What is exciting to me about the plan is that it is broad, and it is very much exemplifies the enormous amount of work that we have to do within the community to help address the enormous challenge that is not only houselessness, but also poverty for our community, and that there's a lot of different ways that our community members have identified that we can be able to do just that. And so there's been a lot of feedback from folks that they see the concerns that they rose in the plan, and I appreciate that. And then feedback as well, just around that it continues to be very wordy. And so even if you were to compare the initial drafts with the draft today, there are considerably fewer words in it. And then even efforts, there are some, high level vocabulary words that have been swapped out for more simple verbiage, just so it's more easily understood by everyone. Next slide. So this is the flyer that highlights the opportunity to share feedback regarding prioritizing action steps. The two ways to do so, that QR code, it brings you to the prioritization survey form that we would encourage folks to fill out. It'll be open through May 1st. And then also wanted to give folks a heads up that our amazing HMIS team is holding its second annual Classy Conference on May 8th. It began a year ago as having a sole focus around HMIS, but this year it's broadened to, not only HMIS, but also just programs and kind of best practices around programs and welcoming agencies to share their best practices. And so I hear at this point there's a wait list, but don't hesitate to reach out because, as you know, folks, they come and go just due to life, and sometimes someone can't make it. So it's worth getting onto the wait list if you're interested. And then last slide. So then this is the second half of the prioritization event flyer. That QR code will bring you to the latest poverty and homelessness plan draft. And then the draft plan link will also bring you to that same draft. As I mentioned, you're welcome to provide feedback to James, or just feel free to send it to myself. And changes are still being made. We're hoping to gather all the information again by the end of this month, and then we'll move forward toward a final draft. Any questions about that?
I have a question that the mayor had about when will the PHB have the opportunity to weigh in and kind of discuss those priorities? What part of that process happens?
So the opportunity will bring the priorities to the executive committee at the next meeting, and then we'll likely need to kind of zoom out and look at the plan itself. And then as we continue to move forward with the work plans, that will bring in the prioritization again. So what that would mean is May, June, July.
Other questions or comments?
And I just want to encourage folks, when you have a chance to dig into the plan, please don't wait for a meeting to provide feedback. And if it's easier to meet, and reach out to James for that opportunity, please do that. What it does is it gives us an opportunity to talk about what incorporating feedback looks like, as opposed to waiting for a meeting like this where, there may not be enough time to really be able to have that more in-depth conversation and to understand kind of what it is that you want us to make sure is heard.
Anything else before we move to the next section? Okay. I want to appreciate everybody and the county staff for all the work on the strategic plan and all the opportunities that you are providing for not only us as PHB, but the community to give feedback along the way, to make it more accessible and really a plan that is being built from feedback from the community. So, and it looks like with that, does anybody have any questions in regards to chair updates from the subcommittees? Is it working for everybody with the chairs putting the reports in and putting them in so you get regular updates? Okay, great.
I like that a lot.
Okay, wonderful. All right. Okay, then with that, we'll wrap up. So, Kate talked about we have several opportunities to have more input into the strategic plan, and our wrap up is fast approaching. It looks like we have the next 3 meetings between having opportunities to give input and coming out with a document that we would be able to vote on and move forward, which I'm sure everybody is excited for us to get that out. And we had the point in time count, but then we did not talk about that on my wrap up. Was there?
So I wish that I had the point in time count to offer to everyone. At this point, so usually the cadence in which it flows is HUD usually has the point in time count due to them at the end of April. And so, all communities work to that timeline and then usually release the point in time count to the public soon after. Because of all the turmoil at the federal level, there is no way to submit the point in time count and the housing inventory to HUD today. There was a meeting recently where HUD staff alluded to the fact that HUD will likely open up a way to submit that information in the future, and that they would provide 6 weeks for communities to submit. And so we're in a kind of a waiting game right now. The primary reason that we wouldn't release it publicly without having released it to HUD first is that every year there are usually like some small changes related to how the data is pulled that HUD prescribes. And so we would hate to release the data publicly and then release different data to HUD later on. So at this point, we're waiting. And you may not have heard that, you wouldn't have heard point in time count information from other communities either, because they're not releasing. And so we're in good company, and my hope is that we will hear from HUD soon as to what their timeline is to release the point in time count information and submit. We did, there's a report called the Longitudinal Systems Analysis, which is another one that, has been submitted to HUD on a regular cadence for years. And this year, the usual cadence was paused. And it just recently opened, and the submission date was, I believe, this week. And so I share that to illustrate HUD is moving forward, but just slowly and in ways that don't match their usual cadences, which, is no surprise just based on our earlier conversation.
Is that very similar for the system performance measures as well?
Exactly, yes.
We did submit our system performance measures so that we can cover, I think, at the next meeting is the plan.
Meeting? Okay.
Yeah.
Thank you so very much. So with that, I think everybody has their assignments. We approved the coordinated entry written standards with some additions there. I do just want in my recap about seeing how we can reach out to other providers around how we can get them involved in case conferencing so that everybody that is providing the service and working with individuals have an opportunity to participate and to try to understand what the barriers are. And then we wrapped up with the next month agenda about bringing the system performance measures. And we'll be bringing back the prioritization around strategic plan. Did I get that? Look at me go today. All right. And before I adjourn the meeting, once again, I just want to thank Glenn for his time in the community and all that he has done, not only for the Poverty and Homelessness Board, but in other boards and committees that I'm on with Glenn, and for his work at the Navigation Center. We really appreciate, and we're going to miss you. And also, just for everybody, I feel like we ended on a happier note than what we started on when we started talking about funding, but I just want to acknowledge everyone at this table and in the community, our commitment to serving all individuals that live in our community. And we have had our ups and downs with all kinds of things, at least, funding cuts and surprise changes of where funding's going to go and prioritized and that. And so I just want to appreciate everyone because we have weathered those storms, even though it has been difficult and it has been frustrating, and we really all would, just like to have the opportunity to serve the people who need to be served. But I appreciate everybody's commitment to hanging in there with all of us as we navigate each and every change that comes across. And I think in the last couple of years, we've had quite a few of those. But we've all been committed and we've stayed the course, and we will continue to do so. So thank you. And with that, I will adjourn the meeting and see you all next month.
Au revoir.
Thank you.
Thank you all. Thank you all, Lane County.